I wasn't surprised by it personally, but we've never been able to make decisions for women with between 1 and 3 positive nodes after mastectomy based on large-scale data. We've always known that radiotherapy is very unlikely to benefit women who have node-negative disease after mastectomy, and we've also known that radiotherapy benefits women who have heavily node-positive disease, so women who have 4 or more nodes. But we have had unclear evidence for women with between 1 and 3 positive nodes. One of the interesting findings in the study is that we now have long-term follow-up for many of the women in the trials. So breast cancer is a disease with a very long natural history, and recurrences and death from breast cancer can happen many years after diagnosis and treatment. So one of the benefits of this study is that it's followed women for 10 years for recurrences and up to 20 years for breast cancer mortality. So I think these results will be very useful because they're based on long-term data. As a clinician, I now have much more evidence to guide my treatment of women who have between 1 and 3 positive nodes after mastectomy based on long-term, large-scale data. And that's currently been uncertain. So really these results are giving us clinicians the tools to work out what are the absolute benefits from radiotherapy for our patients today. And always as in radiotherapy planning, we're trying to balance the risks and the benefits of radiotherapy. And these data give us the tools to estimate what are the risks and the benefits for our women today. One of the interesting findings in the study is that the proportional benefits from radiotherapy didn't vary according to whether or not the women had systemic therapy. And that's reassuring. It means that those proportional benefits that we saw in the study are likely to continue to apply to women who are treated with systemic therapy today. It will be some years before we get direct evidence for this, and there are ongoing randomised trials looking at radiotherapy in this group of patients. But I think we need to wait for that long-term follow-up. And for now, I'm confident that these proportional benefits will continue to apply, or be the best guide for our patients today. We now have much more large-scale evidence to guide us oncologists in whether or not to irradiate women with between 1 and 3 positive nodes after mastectomy. And the majority of women in that group will benefit from radiotherapy. So I think it's good news for women with breast cancer.